This is The O Factor, the podcast with the intent to educate, inspire, and build trust with patients and communities. I'm your host, Dr. O. On this episode, we will talk about setting new goals in the new year, staying mindful about community health, and knowing when to come to the clinic. On today's episode, we have with us Dr. Chanelle Calhoun. She graduated medical school from the University of Southern California in 1991. Then she completed her pediatrics residency at CHLA, and she has been working with us for over 31 years here at TrueCare. She is our clinical director of pediatrics, and she specializes in pediatric care, focusing on whole child and building a long-term relationship with the family. Welcome.
Thank you. I'm very happy to be here.
Thank you for being here with us. And we've established a little bit of, or trying to get a little bit of tradition here. So I'm asking my guests to pick a bobblehead from all the ones that I have here that I collect.
Okay.
Something that calls to you, calls your attention. It'll be with you throughout the this episode. And then I'll ask you to explain why you chose that one in particular.
All right.
Sound good?
Let's go.
Very nice. Black Panther, that's actually one that I just got last year, although it came out some years ago. It's one that I did not attend that game, but tell us why you chose that one.
Well, cinematically, I loved the movie, but in terms of what it represents culturally, historically, it represents transformation, justice, community involvement, power, empowerment. I could go on and on. There's just so many levels to that movie that spoke to me, and so that's why I selected this.
Very good. Well, he'll be with you throughout the duration of this episode, and I want us to get started with, I'll be asking you some questions. We'll sort of talk through different health topics and things that we think are important to our community, the patients we serve, and just the public at large. So you've been part of countless lives and generations, 31 years that you've been seeing patients here with us. What is one aspect that stands out as a provider in the community and seeing former patients years later?
I think what is so precious to me is the privilege of being able to take care of generations of families. At this point, I have what I call great grandpatients. So when I first started here in '94, the very first great grandpatient I can think of was a teenager who then had her first child, and she became my patient, and then her first child became my patient. And so I have many of those stories, and many stories of when a mother may accompany her child with their new baby, and then the mother will say, "Do you remember me?" And I'm like, "Yes, I remember you." Or they're surprised that I remember them. And it's just a beautiful tapestry of relationships and involvement with families and feeling actually to be a part of the community. I actually live in Oceanside. My children were educated in North County schools and participated on teams, and I've had some other patients who were on soccer teams with my kids, and they're like, "What are your kids doing?" Or I had a mother just recently, her daughter is now in college, and three of her kids were kind of born around the same time three of my kids were. They were born here while I worked at TrueCare. Mm-hmm. And so they catch up on my kids because of that relationship. And it's just a wonderful thing when parents remember me or I remember them, and or they tell their other family members to bring their kids. Gosh, I have so many stories. I had a grandmother come also, and she says her her daughter was bringing the child in for a visit, and the mother asked the daughter, well, who's the pediatrician? And oh, it's Dr. Calhoun. What? Dr. Calhoun is still doctoring? And so she came to the visit to remind me and to see for herself that I was still doctoring. It made me feel really old, but yes, I'm still doctoring.
I think, you have, which, we skipped that part of like your many accomplishments and accolades and things like that you've gathered throughout your career. But I don't know what else, like, diplomas and things on the wall, like mean nothing compared to like stories like that. And the fact that you have someone else, like what else do you want that someone you care for when they were little then became a parent and they have kids of their own, they trust you with their care. That means that you really have a big impact in their life, and you've been doing this for so long that like you say, you can spend a lot of time talking about different stories. But I think to me that's something that's really powerful, and I don't know what else I can ask for if somebody else is bringing their kids to me. I think that's just wonderful. You've mentored and formed directly and indirectly a lot of the generations throughout the time here in North County. Like TrueCare's been here for over 50 years, and
Right.
a big part of that, you've been here seeing a lot of patients, and I personally love that you're still here with us and seeing patients and providing excellent care. So thank you for everything you do with that.
I appreciate that.
Now, I want us to talk a little bit about setting reasonable resolutions and expectations, right? So we're in the first month of the year. A lot of, patients, at the end of the year, like, oh, I'm going to make this resolution. I want to do this. I want to do that. And what I find both personally and when talking to patients or just in general is that oftentimes a lot of those go out the window very quickly because we don't set those intentionally. So I'm wondering if you set any resolutions for this year.
Well, the resolutions I have are a continuation from last year. Last year I turned 62, and for some reason that kind of clicked with being a senior. But on the inside, I don't feel like a senior, but I have my first grandchild, and so I told myself I need to make some changes in my life and be more intentional with my health and wellness, and to be able to thrive as a grandmother and as a pediatrician in the twilight of my career. So back then I had said I want to commit more to healthier eating and fitness and to achieve a healthier weight, because I was getting some of those awards and accolades and I wanted to look good for that. So I did that all of last year, and then this year I said I want to make it more mindful and work on balance. And I think a good way to incorporate the physical aspect of it and the mindfulness is Tai Chi. So that was one of my goals to get started with this year, is Tai Chi.
That's great. I think that's really important. We oftentimes, as clinicians, we would love to say that we practice what we preach, and it doesn't always happen, right? We're also humans, and we need to find ways that are things that motivate us and things that are sustainable, so we can make those changes long term and then take it one step at a time. So, and that's sort of on a more personal level, but from your perspective, what are some of the biggest challenges people and some of your patients or just people in general face when setting New Year's resolutions, and what can they do to overcome them?
I think a big challenge is to set resolutions or goals that you can actually achieve. I previously tended just to have these grand goals, and those would definitely be ones that I would be more likely to not achieve and then give up on. So when you're selecting goals, select goals that mean something to you, that you can realistically accomplish, make specific plans for them. Like instead of saying lose weight, set a specific level of fitness or size or something that you want to be. Not that size is the big issue, but something that you can accomplish versus something more nebulous that you'd be easier to forget. And then develop your plan, get an accountability partner. I'm a big fan of journaling to kind of document your progress and reflect on, and again, make it mindful and intentional. And when you do face those challenges of dropping off or skipping a couple of days, or not eating the way you want, then to reframe the drop off as how you're overcoming that challenge versus you screwed up or you didn't do it or you should give up or you're not good enough. Give yourself grace to sometimes stumble or to need to reconcile the challenges, and then keep committing, keep going back to it.
I think that's really important, and you have to give grace to yourself, because that's what happens. Oftentimes people just get frustrated because the goals that they're setting are sometimes unattainable, and like you just want to make sure that, and you start small, right? Like small steps. And what I counsel patients on, someone who doesn't exercise at all, like I don't want them to go run marathons and just start with walking, right? 5-10 minutes a day,
Exactly.
And then build on that. And then just add to it, and don't try to do everything at the same time, because then sometimes they'll hear from us that, oh, I need to eat healthy, I need to exercise, I need to stop drinking this and that. And they want to do everything at the same time, and then they get frustrated because they're unable to do that. So there's no need to do it all at the same time, right? So there's a lot of talk and information within this past weeks about, the new food guidelines and the pyramid and the inverted pyramid and all that. And I can tell you that, a big percentage of the U.S. population hasn't even followed any guidelines, whether they're in a plate, a pyramid, an inverted pyramid, whatever it is, right? And it's because they're guidelines, right? It's not meant for everyone. It's not meant for everyone to specifically say and do everything that you see on a piece of paper. Like, there's so many things that you need to take into account.
Right.
Something that I do agree with is, eating more healthier, like whole foods and things that they're real, right? So less ultra processed foods and things like that, right? There's a lot of discussion when it comes to that, and removing some like food dyes and things like that. But ultimately, there's also a lot of patients that don't have access to healthy, nutritious food as well. And so I think as a clinician, as an organization, our job is to find ways that we can help educate our patients so they can make better informed decisions, right? I'm not going to sit here and say, like, you should eat this. Like, a lot of people go on social media and say, oh, like, this is what you need to eat. And like, that's perhaps good for them, right? But it doesn't always fit the needs of the patients, and they don't have the whole clinical picture, which is why I always recommend come see your doctor, your nutritionist, like talk, let's make those decisions together, right? Don't believe everything you hear on social media.
Right. That's absolutely. I think a person interested in making those changes should partner with their provider to work on a realistic plan of fitness and nutrition. And I'm just so thankful that TrueCare has invested in having nutritionists for our patients to help in that process.
Yeah, no, I think that's certainly very, very important, right? And when we talk about making sure that we have the resources to be able to achieve those resolutions and the goals that we're setting for ourselves, I think you mentioned before the mindfulness, stress management. Like, are there any tips or things that you share with your patients about like how they can manage that, or also if you can talk a little bit about like some basic recommendations that you give your kids for exercise as well?
Well, stress management. There are lots of layers to that. I guess my advice kind of depends on the level of stress and the location of the stress and the symptoms of the stress. We have lots of patients struggling with anxiety and depression, and a big part of my advice to them in terms of their stress management is working on tools to be able to identify the symptoms of their stress, so that they can recognize the signs and then start using those tools. For example, deep breathing, naming things, using the 5 senses, counting. Those are just more of the acute phase management of the stress when it's happening, like when you're having anxiety or panicking. More of the stress management in terms of prevention would be, of course, the basic things we need to do for our health and mental health is having adequate rest, eating healthy, being physically active. We know that physical activity is as good or better at increasing some of those important hormones and chemicals that are involved with stress, such as serotonin. So with the stress management and prevention, I talked about the nutrition, the physical activity, the sleep, also time for personal reflection and meditation, whether it's yoga or prayer or other types of ways to bring yourself into a place of reflection and peace. Those are all key in stress management. And then ways to divert yourself when you're experiencing a lot of stress, and again, and having those accountability partners in that sense too, as a source of support when you are in those moments of stress.
I think that's really important, and especially that you established that early on in someone's life, because then, and also if we as adults, are able to show our kids and lead by example as well, right? Because I can't be telling my daughter to eat healthy and to exercise and to do this if I'm just sitting all day watching TV and eating, and like that's this better than myself. Then like how what kids see in their parents, they often try to mimic, and like that's how I grew up and that's what I saw, and that comes out as an adult as well. So I think it's really important to establish that early on. Very, very important as well. I'm going to shift gears now and talk a little bit about when to go to the clinic. We're in the winter right now. We're seeing a lot more cases of influenza and many respiratory diseases that perhaps we see more during the winter. But in your experience as a pediatrician, do you find yourself seeing more patients during the winter than other times of the year? And any recommendations that you have for parents to bring their child into the clinic?
Yes. So the winter time is classically a busier time for pediatricians. The winter is when certain viruses, like influenza and the common cold viruses and COVID, thrive. They're more stable in cold and dry weather, so they tend to flare up during those times. Children in school and in daycare definitely are prone to share a lot of germs, and that's when the numbers start building. And then we get to the holiday breaks and people are in close quarters because it's cold outside and they have the heaters on. And so that is just a hotbed for transmission of infections. So yes, we are busier during the wintertime because of those factors. When should a parent bring their child in? The bottom line is, if you're concerned, you can make an appointment and we can see your child with whatever the concern is. Some basic guidelines would be for a persistent fever maintained over a couple of days, or having symptoms associated with it that are concerning, such as pain, an earache, or pain with urination, problems breathing, complaints like with wheezing and asthma, new symptoms that are unexplained, change in behavior, such as signs of dehydration and lethargy. Those are all reasons. Let me put a caveat on the fever. So for children 3 months and younger, they should be seen for fever on the first day. Don't wait. But children that are older, fevers can be observed, and you can reach out to the providers on call if things happen overnight, or reach out on my chart during the day, call the office, speak with an advice nurse. There's many different layers that we have available to be in contact. But again, with any concern, if you want your child seen, then we'll see your child.
Yeah, that's great. I think you bring up a good point. I think that's the whole reason we're here. And what I'm hearing you say is that exactly right. Any concern, you have a question, whatever it is, we have different ways to get answers to our patients, right? You mentioned like sending us a message in my chart, right? Like you can send a question there, you can contact our on-call provider, you can, walk into our clinics, you can schedule appointments. There's different ways that we have that we're here throughout, year round to care for our patients, and we're always looking for ways that we can bring those services and extend the hours. I see, some of our clinics have extended hours, and because, parents work, and sometimes you get out of work and somebody was taking care of your child, oh, by the way, I've been having this, and what do I do? I have to go into work tomorrow. And you also want to make sure that you use the resources appropriately instead of showing up to the emergency department for something that could have been taken care of at the clinic level. I think that's really important. So thank you for highlighting that. I think we do our best to show that and let the community know that we're here, but it's always good to hear it from someone who's seeing patients and leading a department such as pediatrics. So something that also has been sort of a hot topic lately, and I want us to just let people know what the stance is here and what we follow, right, when it comes to the immunizations, right? So you can prevent, there's a lot of things you can do to try to prevent some of those diseases throughout the winter. And one of those ways is vaccinating patients, right? So we understand that vaccines continue to work.
Yes.
They have been proven to be safe, and some of them are not perfect. I'll give you the example of the influenza vaccine, right? So every year, if we always have the same vaccine, well, that's not how it works, right? So we're looking at the different viruses that they're circulating, but it's proven to be safe. And I think a big point is to ensure that people understand that it's not a simple cold that it's preventing. It's the disease of influenza, which has complications, which can be fatal for kids and adults who are immunocompromised as well.
Yes. Last year, there were 17 in San Diego County that died because of influenza.
And that could have been prevented with a vaccine, right?
Yes, that's correct.
Something as simple as that. So I think that's something that we want to highlight as well, that we have the access to the vaccines, and that if you can give me your advice, your opinion on the vaccine schedule, right? Because there's been some recommendations and changes that are out there currently.
Vaccinations are the number one major public health accomplishment in the world. Vaccinations have saved millions of lives over the years and prevented millions of diseases and disabilities because of preventable diseases. And our current vaccine schedule is based on evidence, scientifically proven to provide children immunity in a very safe fashion and protect against many, many devastating diseases. There's currently been some modifications to the schedule in an effort to mirror the schedules of other countries. The American Academy of Pediatrics and the Western Alliance and various other entities overwhelmingly support the American Academy of Pediatrics schedule. And as a company, we are standing on that schedule as well and continuing to deliver vaccines based on that schedule. The schedule is evidence-based and scientifically proven, and as a pediatrician and the clinical director, I firmly stand on that.
Yeah, and I think thank you for saying that, and I think a good point also to make is that the insurance and the health plans, right, are covering the vaccines, and that we have ways to get the vaccines to patients. If you have questions, you can have a conversation, right? I invite everyone to come and have that conversation with the pediatricians, the people who went to medical school and got trained and have learned about the data and are keeping themselves up to date on everything that's happening.
Yes.
And that we have that conversation and decide, right, ultimately, right, because it's a shared decision making instead of just me telling you you need to do this. I'll give you the reasons why, and then you can make that decision. But I think ultimately is having those conversations and understanding that that's information, scientific information that's been there for so many years, and I think it's important that we pay attention to that. So
there's so much misinformation that's being passed around now too, which is concerning, and so. As a pediatrician, I do try to spend a lot of time educating the families in terms of the schedule and not changing the schedule or declining vaccinations. It's becoming much more common now because of the changes and the misinformation, but our department is firmly committed to providing that education to allow parents to make the best decision for their child.
Yeah. That's what we're here to do, so thank you. So I'm going to shift gears again and talk about just like community health, wellness, and mindfulness, and just the health of our community, right? So even outside of what we do here in the clinic, when you sometimes have one, two, I've in the past when I used to see kids, I've had 3 kids like in a family. I'm sure you've had more than 3 at the same time. What can you share? What was the highest number of kids you've had in the family taken care of, like in one visit?
In one visit? Well, so in general, we tried to limit it to 2, but in special scenarios, like if someone all has pink eye, I think the largest number I've had in the room is 5 siblings, or for a skin infection. And it's controlled chaos, hilarious, but fun, and just being around kids and their dynamics and shenanigans. It basically, I'm a pediatrician. It's hilarious and rewarding and entertaining. I love it.
And again, like we said before, you've been doing this for so many years, especially here at TrueCare. And I do want to ask you, what do you think are some ways we as a community can be mindful about health, right? So exiting the rooms and when people leave our clinics, like as a community, how can we be mindful about health in general?
There are a lot of layers to that. Well, first of all, I think we need to consider ourselves blessed to live in this area. We have an abundance of resources and beauty and amazing things to do as a community, and we need to be stewards of that in terms of taking care of our community, eliminating waste and excess. We need to protect our resources and have green places to be able to play and exercise and walk. And that's something that we as TrueCare support in terms of the initiative Walk with the Doc. We strive to educate our community on the importance of being connected to fitness and in our community with walking. Healthy nutrition, access to foods, and fresh foods and fruits and vegetables by supporting our local, sorry, I'm going blank on it.
Food banks?
The food banks, but also the farmers markets that we have here on Thursdays. And TrueCare also is a big part of that, and in our food delivery services, not food delivery, but what would you call it when we?
Food distribution.
Food distribution services. We understand the importance of nutrition and providing those resources, and we've partnered with other companies to bring food to our populations. Other things that we can do in the community is to provide education and access to healthcare. And definitely TrueCare is very committed to that and providing access. And we participate in community activities to educate our families and our residents on healthcare and screenings and cholesterol and diabetes. And I think that's one of the most impactful things that we can do as a company and as individual providers is to give that education and right where the patient is and the community.
And I think those are all great examples of what things that we can do for our community and that everyone can do. And I would also add that, there's this month, it's National Blood Donor Month. So we can also encourage, which we do. We actually hold blood drives here,
Yes.
right, through like once a year. And we encourage not just the community, but our employees as well to donate blood. And those are different ways, such as, the food drives and different programs that you mentioned. So those are great ways to get involved and volunteer and just be part of the community for, because that's very important for health in general and for living longer and healthier. So
Yes, volunteering is actually something I do bring up a lot. We have a volunteer program here, and for patients that I have that are teens and they want to work in healthcare, I suggest that they volunteer. But people, our patients, can volunteer and support us as well and participate in our different outreach events, and that's something that's really important and very good for your health, like you said.
yeah, it's great. Now, I want to just give you an opportunity to share some of your final thoughts and like just sort of like an open-ended question. Anything that you would like to share that we haven't discussed, related, unrelated to the topics we've talked about, that you want our viewers and listeners to know about?
Well, this morning I was fortunate to attend the Martin Luther King breakfast, the annual breakfast. That's sponsored by the NAACP, and that's always very inspirational and motivational. And there's one quote that has always stuck with me. The time is always right to do the right thing. Something to that effect. The time is always right to do the right thing. It's always the right time to do the right thing. That's kind of been my mantra. Just do it. It's what needs to be done. Whether it's your personal health, it's the time now is now to invest in it. The health of your community, activities in the community. There's such turmoil right now, and it's important to dig in and to continue to pour into yourself and your health and your peace and your commitment to buttress your foundation, basically, to keep the fight. And I think my what I want to share is just continue to pour into that, whatever provides you that strength to keep going.
I agree. I think that's really powerful and just a good way to end this segment on just, we're starting the year off. Oftentimes people wait like, oh, I'm going to wait until the beginning of the year to do this, to establish this new health goal or just goal in general. And, there's people say like the best day to start something or to do something new or to like start a goal was yesterday, and the next best day is today, right? So however you say, in whichever way you see it, you have to give yourself that opportunity to make those changes and just be patient and give grace to yourself that you're able to do it, and don't do it alone, right? So bring others, and that's what we would spend some time talking about the community, right, and the things that we do in general and things that we can do for the community at large as well. So I do want to thank you for spending some time here with us and
thank you.
Just talking about things that we can do, and hope to have you back in the future as well.
I would love to be back. Thank you.
Thank you. This is Myth and Medicine, a segment where we answer any health-related questions you have. Today, we received a question about how bad is it to doom scroll before bed, and do I need to put my phone down an hour before bed? I think it's important to understand that just in general, it is good to avoid using your phone as much as you can before you go to bed. It doesn't have to be 1 hour specifically, but what I can tell you is that the blue light tells your brain that it's still daytime. So if you're looking at your phone, your brain is getting signals that it's still daytime and delays melatonin, which is a hormone that is needed to go up as it gets dark so you can sleep. So it's always best to an hour, sure, but if you can do 30 minutes, 20 minutes, anything you can do would be helpful. And then also depending on the type of content that you're looking at, that could potentially keep your brain in alert mode and then provoke anxiety and give you other problems as well. So I would just try to avoid it as much as you can, but there's no specific time that you need to do that for. I also received another question that says, how important is eating breakfast? I feel fine not eating in the morning. I think that can be true for a lot of people. There's no one size that fits all. I think it's more important when it comes to kids, adolescents, and also patients who have diabetes, and specifically those who are injecting insulin. I think it's more important what you're eating to break that fast, ensure that it's healthy, nutritious foods. There's a lot of people that like to fast, and that's okay, and that don't have necessarily 3 meals a day. And you hear that breakfast is the most important meal of the day. It can be for some people, but I just want to ensure that you understand that no one size fits all, and then you take it based on what your specific needs are. If you have any questions, you can talk to your healthcare provider, and they can help you, guide you through that as well. Do you have any questions? Type them down below, and maybe they'll get featured in our next segment. Thank you for tuning in. Remember, insurance, no problem. TrueCare keeps health within reach.